Bone is living tissue. Bone building is far from complete when a baby is born. During growth, from infancy to adulthood, bone is increased in size, strength, and hardness. Also, in different parts of the body, bones grow at different rates. Bone growth is partly in response to stresses that are put on the bone by weight-bearing motion. The simple acts of walking, running, jumping, and lifting heavy objects put strain on bones that results in increased bone density. Trabecular bone is found in the shaft and at the ends of the long bones, inside the spinal vertebrae, and inside the flat bones of the pelvis. In the ends, trabecular bone completely fills the cavity, and its structure transmits stress forces to the shaft. Trabecular bone forms an internal scaffolding network for bone. The trusses and arches found within the trabecular bone provide for the great strength of bone and yet surprising lightness. The arches and trusses inside trabecular bone provide a sponge-like appearance in the bone and also create the opportunity for blood vessels to penetrate the bone structure from the center core, marrow, of the long bone. Bone remodeling is such a thorough process that one's entire bone structure is replaced approximately every 10 years. Once maturity is reached, about age 30, the process of remodeling slows and the loss of bone calcium deposits exceeds the replacement of the bone structure. Beyond this point, it is no longer possible to substantially increase bone density. Over time, the density of the arches and trusses diminishes, and the spaces between them become larger. This process leads to a general weakening of the bone structure. It is a very gradual process and requires decades before any noticeable bone weakness appears. Osteoporosis is the end result of the erosion of the arches and trusses. Osteoporotic bone has much larger spaces between the arches and trusses and is significantly weaker than normal bone. Therefore, it is more prone to fracture. This condition is responsible for many injuries related to falls in elderly people. Women are more susceptible to osteoporosis than men. This is probably related to hormonal influence on bone growth and calcification. Also, dietary intake of calcium and other nutrients, including protein, phosphorus, vitamin A, vitamin D, vitamin K, magnesium, zinc, and copper will influence bone density, in that deficiencies will cause decreases. Finally, genetics have an influence on bone density. Here is the progress of bone loss in a person who has taken some precautions related to osteoporosis onset. Note that as the aging process continues, the rate of erosion of the trabecular structure has slowed, and the end result at age 70 is bone that is stronger and denser than a bone with severe osteoporosis. Strategies for preventing osteoporosis are different for young women and older women. Young women should be sure to meet their needs for calcium, vitamin D, and other nutrients. Physical activity of a weight-bearing nature is also important to maintain bone mass. In postmenopausal women, estrogens, estrogen receptor modulators, and calcitonin can slow bone turnover by binding to bone receptors. Calcium supplementation and regular exercise, especially weight-bearing and resistance activities, are important strategies for older people. Finally, since both tobacco smoking and alcohol consumption have negative effects on bone growth, these behaviors should be avoided for healthy bones. In summary, osteoporosis, the weakening of bones due to loss of calcium and phosphorus from the interior of the bone architecture, is a degenerative disease that is influenced by many contributing factors. Health-promoting interventions such as adequate nutrition and physical activity, and medical interventions such as prescription medications designed to limit progress of osteoporosis, coupled with positive behaviors such as not smoking or using alcohol excessively, can forestall the onset and severity of osteoporosis. Men are also at risk for developing osteoporosis. For men, similar prevention strategies apply. These include adequate calcium, vitamin D, and other nutrients, physical activity of a weight-bearing nature, and avoidance of behaviors like smoking and excessive alcohol consumption.